again. So welcome everybody. Thanks so much for joining our webinar today on breathing pattern disorders. Thank you very, very much to Lorna Nicholson for giving up her time again today. As most of you will know, Lorna is the founder of POTS UK. So it's got a lot to be grateful to Lorna for, and she'll explain a bit more, I'm sure, about her background and how the session's going to run. We're anticipating it's going to be about 45 minutes, but it will kind of depend on how many questions we have come through. So we'll see how that goes. As always, it's going to be recorded and go up onto our YouTube channel. So if you can't stay for the whole session, you'll be able to catch up later, or if you want to share it with anyone afterwards, then that will be a possibility. Again, as always, there will be a questionnaire. It is quite simply 2 minutes, and it's really helpful if you can fill that in afterwards. The link will come up when the session finishes, when you close the box. And then just very, very quickly, I just want to remind everyone that this month we have got our Take a Stand for POTS campaign. We're having a massive push to raise awareness about POTS. And I just really urge everyone to get involved, like keep up to date with our social media channels if you're on social media. If you're not, we've sent a newsletter. In order to receive those, you need to be a member, which you can do via our website. But just any support you can offer the campaign, even if you educate one other person, that is a massive step forward. You know, we really need to work as a team to do that. So anything you can do would be fantastic. So I will hand over now to Lorna. Really looking forward to hearing everything you've got to say today. I think lots of people are, and I'm sure we're going to be inundated with questions, but over to you, Lorna.
Thank you. So just to say a little bit about who I am. So as Jo said, I'm Lorna. My background is in nursing. I most recently worked as an advanced nurse practitioner in primary care, currently given up that job to do other bits and pieces and to do a bit more with POTS UK. Lots of writing and lots of breathing. I teach Pilates. I have general classes. I've now got a class for people with POTS, long COVID and hypermobility, which is online, which is great. And I've also trained in Buteyko, so it's a technique for breathing. My interest in breathing came about because I teach Pilates teachers about POTS. And there was a study done by Nick Gall's team in King's that stated something like 80 to 90% of people who were referred to a respiratory physio had a dysfunctional breathing. And I was thinking, so I'm teaching the Pilates teachers this, and I'm thinking, what is that? All my years of medical training, I've never heard of a dysfunctional breathing pattern. So I thought I need to go and find out about this. So I did. So that's when I started my investigation and trained as a Buteyko teacher. And it's like, oh my word, this really is a thing. This is actually quite important. So since then, I've just been very passionate about raising awareness about breathing pattern disorders, particularly around POTS. And now I do a lot of work with people with long COVID as well, and people with POTS long COVID. And I run a bit of a breathing workshop online as well as many other bits and pieces. So to begin with, so if you want to just generally chat, put in the chat. I'm going to ask you some questions on the way, so answer my questions in chat. There's also a question and answer section. If you have a specific question, put it in that bit, and at the end, I'll go through some of the questions that I've had in to me, and feel free to add questions as we go along. You might find, I noticed somebody's put a question in there already. You might actually find that I will answer that question as we go through, but we will see. But if you have a question, please feel free to put your questions in there. I want to make this as interactive as possible. I want to hear from you. I like hearing from you, and we can learn a lot from each other. How long should you be able to hold your breath normally? Put that in the question and answer, and we'll come back to that. So we're going to do a breathing, a bit of a breathing awareness to begin with. So I want you to sit up tall, put your hand on your chest. So hand on your chest just below your throat, and hand on your stomach just below your rib cage. So that's where you want your hands to be. And this is just about becoming aware of your own breathing. So I'm going to ask you some questions. So just take your attention onto your breathing and just be aware of your breathing. So ask yourself these questions. At this moment of time, are you breathing through your mouth or through your nose, or maybe both? Notice the rate of your breathing. Does it feel fast? Does it feel slow? Notice your hands, the hand on your chest and the hand on your belly. Just be aware of how much movement there is. Which hand is moving more? Is your belly hand moving more? Is your chest hand moving more? Are they working equally? Is your breathing smooth or is it erratic? So smooth is breath in, breath out, breath in, breath out. So a gentle wave type pattern with your breathing. Are you holding your breath? Is there a gentle pause when you breathe out before you breathe in again? Or are you needing to immediately take a breath in? Is your breathing really noticeable, or is it quiet and soft? So what I'm going to do, I'm going to launch a little bit of a poll, just asking you one or two questions. So answer as best you can. There we go. So this is just on your observations of yourself at that moment of time when we were doing that exercise. And we'll just see what happens. Okay. Oop. So, which hand was moving more as you were breathing? We've got 10% where both were breathing at the same time, 25% where the hand on the chest was moving more, 59% hand on the belly was moving more, and 6% not sure. So breathing in and out through your nose, your mouth. So we got 94% nose, great, 6% mouth. So a couple of people mouth. Oh, we've got a not sure there. Okay. Oops, I can share results. There we go. So as we go through, as I talk, we'll just talk about some of that. We'll look at what normal breathing is and what we hope to achieve. So that was a breathing awareness more than anything else. So I'm just going to share my screen. I've got a few slides, but not too many slides. Okay. So I see breathing as one part of, this is my POTS pie. So when we think of the management of POTS, we need to consider all these bits. We can't just consider one part in isolation. So we've got the physical activity, so keeping yourself active, the joints moving, muscles strong and long, looking after your mental well-being, pacing, fatigue management, sleep management, diet, fluid, could add in compression there. And we've got medication, which helps a lot of people and very much has a place, and managing stress, which we'll talk a little bit about, because most of us know that stress will make our symptoms much worse, and breathing. So when I'm talking about breathing, I'm not saying if you fix your breathing, you're going to fix your POTS. What I'm saying is learning to breathe well can buy you a spoon. And I say that we need to use every tool that we have to, if you can buy a spoon by breathing a bit better, then great. And that's the way I see it. So this is all about how can you gain a little bit more energy here, a little bit more energy there, that might make you feel a little bit better. So this is a question for you, if you can answer it in chat. What is your understanding of the difference between a big breath and a deep breath? So Joe, do you think you'd be able to read out some of the answers to that? Big breath, deep breath. What does that mean to you?
So we've got, I'm not on mute, am I? No.
No,
so we've got some people just saying that they think they're the same. Somebody else said not sure. Again, I thought they were the same. A big breath is a sharp intake of air, and deep is slow and long.
Yeah.
Big breath is filling lungs. Again, quite a few people not sure. A big breath happens when I'm trying to breathe and it's not working and not enough.
Yeah.
A deep breath is into the belly. Big breath is over breathing.
Yep.
And a big breath more like air hunger.
Yeah.
Deep breath is diaphragmatic.
Yep.
A big breath, just a big gulp as such. Deep is trying to breathe into the bottom of the lungs.
Yep.
Deep breath, more conscious. So loads of great things coming through.
Yep.
Also getting more air to essential bits. A deep breath is satisfying, a big breath is not.
I think that's enough.
Sorry if I've missed anybody's comments there. They were all coming in thick and fast.
Yeah, I'll have a read through later, but it's interesting. It's very, very mixed kind of how you interpret these words is very different for different people. So you're right. Some people, I think of it as, you might hear somebody say, take a deep breath, which kind of means take a big breath. So it can be interpreted in different ways. So just be aware of that. And you might find medics say, do some deep breathing, but how you interpret that might not necessarily be correct. So I'm just going to talk a little bit about how should we breathe at rest and why. So we'll answer the question about the big breath, big breath, deep breath. So nose. So the first thing is normal breathing at rest should be in and out through the nose all the time. Most of you are nose breathers. That's great. It would be interesting if I asked the question during your whole day, are you nose breathing all the time? Or are you finding that there'll be, if the exertion gets more, will you start to mouth breathe then, which a lot of people do. So we want to aim to be nose breathing in and out nearly all the time, except with really high level of exertion, which I suspect most of you won't be doing that level of exertion. And I can honestly say it's really hard work to do. If you can get it, if you can use your nose, even with exertion, you will save, it will gain you a bit of energy, it will gain you a spoon. I've worked with a number of people with POTS around the whole nasal breathing thing, and they've honestly said that they've gone for a walk on the flat, nothing mega, and they're less dizzy. One lady says, I managed to get up my little hill without hugging the tree at the top of it. So it really can make a difference, and part of the reason for that is it will slow down your breath. So that's one of the key things. You feel like you're not getting enough air in, but you most certainly will be getting more than enough air in. So then breathing needs to be slow. So often people with dysfunctional breathing are breathing too fast and too much. So just spending time slowing down the breathing can be really helpful. So abdominal belly breathing. So this is what I was asking about, your hand on your chest and hand on your belly. So at rest, there should be very little movement in your chest. And most of the movement should be in your belly, your diaphragm. So I'm using abdominal belly breathing because the diaphragm is a big muscle which is used with all forms of breathing. But just doing an exercise where you have your hand on your chest and your tummy, and you slow down your breathing, and you just become aware of how much movement there is. Another thing you can do is get somebody else to watch, because I've had clients where I've done this with them, and they're like, no, my belly hand is moving, but my observation of them is there's a lot of chest movement as well, but they weren't tuned into that. So that's where it can be useful to get some individual input as to what's actually happening with your breathing. So this is where so a deep breath, abdominal breathing, diaphragmatic breathing is kind of all the same thing. Deep breath, like we said, it is a deep breath. You're taking the air into your nose, into the base of your lungs, as low as you can direct the air. That's where we get most gas exchange. But because the way the use of words, the big breath and deep breath can be used interchangeably, I think it can be misleading. So you're right, a big breath is a sort of taking a massive gulp of air in, inflating the lungs, overinflating the lungs, and that's over breathing. You're breathing too much. So I think of breathing to be through the nose, low, using abdominal, belly breathing, and slow. And so quiet. So when you're breathing, you can hear yourself breathing, you're very huffy puffy, as I say, then you're again probably over breathing. So we want the breathing to be quiet and light, effortless, rhythmic. So the nice wave shape, gentle pause on exhalation, not visible, and at rest, a respiratory rate of between 8 and 12 breaths per minute. So this is at rest. As the level of exertion increases, this will increase as well, but we don't want it to increase massively. So sometimes with POTS, you're great at rest, but as soon as you stand up, there's a rapid increase in respiratory rate because of the heart rate. So that's just a little bit on what is normal breathing, what we're aiming for at rest.
Sorry, Lorna, we've got a couple of people who've got their hands up. I don't know if you want to pop your questions or let me know if there's any issues into the Q&A box, and then if it's anything that we don't need to come to now, then Lorna will pick up at the end. Is that all right?
Yeah. Okay, I'll come back to question and answer. So breathing pattern disorders, what is it? So there are terms. So breathing pattern disorder is one term. Dysfunctional breathing is another term. It kind of means the same thing, but I found it quite difficult in the literature to actually pin down when is it a breathing pattern disorder? When do you call it dysfunctional breathing pattern? My understanding is I think it's the same thing. And I see it as a bit of a spectrum. So you've got on one level optimum breathing, so breathing really well. On the other end of the spectrum, you've got hyperventilation syndrome, which is breathing too much, too fast. Your breathing is greater than the demands that your body need. And hyperventilation syndrome is often sort of linked in with the dysfunctional breathing, but there's a spectrum. So the Nick Gall's paper, they identified the 80-90% as people who have this hyperventilation syndrome. So it's kind of at the extreme end of a breathing pattern disorder. But there's all sorts of variations in between. And I would say nearly everybody can learn to breathe better. So I would say we're all on this spectrum somewhere. So for me, I had to learn how to breathe through my nose with exercise. And the only reason I didn't was because my nose was running. But with time, that's improved, and it has improved my exercise tolerance. Because it's slowed my respiratory rate down, I'm not gasping for air. So when we think of a breathing pattern disorder, this is my understanding of it. It's not well classified, there's not clear definitions of what it actually means. and that there's very little understanding and awareness amongst the medical professionals as to what this is. So most certainly if you speak to your GP, they probably have never heard of it before or hadn't realized it's a thing. So just be aware of that. So Joey's going to put a link to a bit of a breathing pattern disorder assessment form. Don't feel you need to look at it now. You can save the chat and Joe will send it later as well. And it's just a form. It's a bit of a self-assessment as to whether you might have a breathing pattern disorder. Joe's just going to put that in chat.
Yeah, I've popped that in there, and I will also, yeah, I'll email everybody out afterwards.
Thank you. So signs of a breathing pattern disorder. So here are just a few of them. So breathing through the mouth, hearing breathing during rest, regular sighing, regular sniffing, taking large breaths prior to talking, yawning with big breaths, lots of movement with your upper chest, a general visible movement of breathing, and the feeling of not getting enough air in when breathing. So this whole thing of air hunger comes up an awful lot. When I talk to people with POTS and long COVID, I don't feel like I can get enough air. I don't feel the air is getting to where I need it to be. I feel the air is stuck in my upper chest. So what I'm finding with POTS and long COVID is that people are breathing too fast, too much, and they're using their accessory muscles. So the chest, shoulders, neck muscles are working. Again, this uses energy. It uses a lot more energy than if you're just breathing diaphragmatically. So again, just think about how much energy you can save yourself just by learning to slow down your breathing, allow yourself to belly breathe, steadying the upper chest. This isn't easy to do. It's a bit of a process, but it takes time and practice and awareness to start shifting, or becoming aware is the first thing that you need to do. So when breathing pattern disorders are really common in many health conditions. So this isn't unique to POTS or long COVID. So 30% of people with asthma have some sort of breathing pattern disorder. 90% of people with fibromyalgia, 70% of people with anxiety, and it's very common amongst people with lower back pain as well. And that's just what's documented in the literature, and I'm sure that there's a whole lot more. So it pretty much affects most health conditions. And about 10% of the population have hyperventilation syndrome. So that's the sort of more extreme end. So it's high in the general population anyway, but all of us can learn to breathe better than what we are, wherever we're at. So it's a bit of a spectrum. So this is my what I call my cycle of breathlessness. So you feel breathless, you feel like you're not getting enough air in, you feel that you can't breathe, which creates stress in the body and it creates tension in the body, which is going to make you breathe faster through the mouth using your upper chest accessory muscles. You get rid of too much carbon dioxide. So carbon dioxide is the key driver for breathing. So if we get rid of our carbon dioxide, then the amount of carbon dioxide in our blood is too low. And for some people, it's not too low, you're just too sensitive, you're really sensitive to the carbon dioxide. And then that in turn results in all the sort of symptoms that you might experience yourself. So dizziness, fast heart rate, sweating, chest discomfort, sense of anxiety, feeling of not getting enough air, fatigue, allergies. So I've just listed some other symptoms that might be associated with this low carbon dioxide. Low carbon dioxide, it sort of shifts the body chemistry. So you've got this acid-base balance, and you become a bit more alkali. So the balance is shifted, and that has a whole chemical effect in the body. So there's biochemical changes in the body if you're over breathing for a length of time. So other symptoms of this overbreathing when you end up a bit alkaline, postnasal drip, so sinus congestions, ear pain, back pain, TMJ dysfunction, so this joint here, pain, shoulder pain, neck pain, chest pain, tightness in the chest, irritable cough, cold hands and feet, palpitations, feeling dizzy, tingling in the fingers, numbness in the fingers, poor memory, balance problems, feeling unstable, headaches, migraines, a sense of anxiety and depression, irritable bowel, acid reflux, difficulty in swallowing, dry mouth, and fatigue. So they're just a list of some of the symptoms that can occur just from not quite breathing right. So over-breathing, you end up in this slightly alkalotic state. So why does this happen? So we'll go back to the autonomic nervous system. So what we do know with POTS is that there is a dysfunction in the autonomic nervous system. There's lots of theories as to why people have POTS, but this is a bit we know. There is something wrong with the autonomic nervous system. So you've got your sympathetic, parasympathetic nervous system. Sympathetic is your fight, flight, getting ready to respond to perceived threat. And if we are in sympathetic overdrive too much of the time, our heart rate goes fast, our respiratory rate increases, blood pressure can go up, sweating, adrenaline, glucose production, we're getting ready to fight the battle. But this fight-flight response is meant to be a short-term response. But as Tanya Clifton-Smith, who runs Bradcliff Breathing, she says, in this society today, we are addicted to stress. I thought, yeah, we have so many stresses on our life. So no wonder so many people are in this sympathetic overdrive. And this is one of the reasons what's driving this over-breathing, fast breathing. If you think when we were hunter-gatherer days, we would fight the battle. You would be in the sympathetic nervous system would activate to be able to deal with the battle. With that, you've got cortisol, adrenaline. You've also got the inflammatory markers. So it's linked with the immune system to potentially get, if you're going to be wounded in battle, to help you heal. So the hormones are there and ready. But if this mechanism is going on day after day, then that has an impact on our health. Hunter-gatherer days, they would do their fight and then they would go and rest and digest and recover. But we never give ourselves time to recover because we're just on this overdrive all the time. So just thinking about some of the stresses that might be causing this. So your current life stresses, so things that are going on in your life at the moment. You've got self-induced stresses, so your personality types will influence this. And then you've got your past stresses, so things that have happened in the past, childhood stresses, and all of this is going to influence your breathing. So stress is one of the big causes of dysfunctional breathing, but there are many other factors which will also influence it. Oh, let me show you this one. This is my little list of personality traits or self-induced stresses. And most people I show this to who have POTS or long COVID, their mouth drops and they're like, oh my word, I'm every one of them. That's so me. So have a look at that and just take a note to yourself. Is this me? I'll give you a moment to read that. So then just thinking about some of the other causes. So these are other factors that are going to influence breathing. At the moment, it's warm outside, humidity. That's a big thing. That's going to make you breathe a bit faster. Maybe this is a reason why people with POTS struggle this time of year when it's humid and the weather's hotter. Has it influenced our breathing in some way? Progesterone, hormones. I find this really interesting. Progesterone, part of the menstrual cycle, between ovulation and menstruation, the amount of progesterone increases, and progesterone increases breathing rate. So this might be part of the reason why some of the premenstrual symptoms occur, and why POTS symptoms might be worse. If you're just breathing, if you're breathing a little bit not quite right, and then you've got something like premenstrual time that makes you breathe a little bit faster, then it will shift your acid-base balance a little bit. So that might worsen some of the symptoms. So if you've got an underlying respiratory condition, that will influence it. Pain can be physical pain or psychological pain. Refined sugars and processed foods. So high sugar foods will influence your breathing. Tight fitting clothing. Often people like to wear tight fitting clothing, but if you have something really tight, try and belly breathe, and it's actually quite difficult. And I've got the picture of the Victorian lady with their corset on. If you think that the diaphragm is squashed, so you often see the picture of a Victorian lady fainting and their corset being undone so they can breathe properly. So the corset is stopping them from breathing efficiently. And also linked with POTS is histamine release. Histamine is part of the immune system. It's released with stress and inflammation, such as allergies, and that's going to influence breathing as well. So they're just a few things there. Posture, the way you sit. You're probably, if you slump in a chair all the time and you're squashing your respiratory muscles, that's going to influence your breathing. And sometimes habit. Some people just, with COVID, I think for some people, they have an acute respiratory infection, which they start to breathe differently because of that. And the outcome of that is they just pick up a bad habit. So that's the end of that bit. Let me come out of my sharing. And I can have a look at some of the chats. So let's go back to our breathing awareness. Put your hand on your chest and your tummy again. And just focus on breathing in and out through your nose. As you, when you start walking, if you start finding it really difficult to breathe through your nose, think of breathing out through pursed lips. So you breathe in through your nose, breathe out. It slows down your breathing and it helps keep your breathing under control. Breathing out through your mouth, you get rid of too much carbon dioxide. So by slowing down your breathing, you're just trying to retain some of the carbon dioxide. So that's a step in between if you struggle to breathe through your nose. So try to slow down the rate of your breathing, even just a little bit. So there's a lot in the literature, or you might even have been told, try and get your respiratory rate down to 6 breaths a minute, which is great if you can, but for most people I've come across with POTS, it's too big a step. You need to take smaller steps to get there. By really slowing down your breathing, it helps access the parasympathetic nervous system and shifts this sympathetic parasympathetic balance. So just slow down your breathing. So there's 2 ways to access the parasympathetic. One is really slow down your breathing to 6 breaths a minute. The other one is prolonging your out breath. So that's something else you can do, is just focus on your out breath and just make your out breath longer than your in breath. As your hand is on your chest and your belly, just allow your belly hand to rise and fall, and try and keep your hand on your chest a little bit more steady. Try to make your breathing smooth, and just try and relax your breathing. Quieten your breathing, soften your breathing so it becomes less noticeable. if after all of this and you fill out that questionnaire, I'd really encourage you to get some support with your breathing. It really makes a difference to work with somebody who can watch you breathe and just give you some specific pointers as to where to go next with it. So question for you, you can answer this few questions with you. You can put this on chat. If you have had any breathing re-education, what has helped you most? What have you found most useful? And how has it improved your symptoms? What have you noticed yourself? And is there anything that you found difficult? Thanks. So I'll give you a moment to have a look at that. Let's have a look at some of these. I'm going to go to the questions while you have a look at that. So Jennifer, can yawning, yeah, so you're yawning, if you're over yawning a lot, and that becomes noticeable, then it's part of this breathing pattern disorder. How long should I normally be able to hold my breath? That very much depends. There's not a set breath hold time. I've come across people with long COVID and POTS whose breath hold times are less than 10. So I'd say for a normal person, well, to be honest, most people who I've worked with, their breath hold times, this is breath hold on exhalation, is between 10 and 20. Somebody who's trained can be 25 to 30. But it partly depends on what you're meaning by a breath hold time and how are you going about doing your breath hold times. And personally, I wouldn't worry about breath hold times. It's an indication, but not in itself. It needs to be considered in the bigger picture of what's going on. Let me have a look. Oh, right, let's have a look at some of these. I was told that I breathe too slowly by respiratory physio. I'm also worried that if I breathe too slowly, that it may make the bradycardia worse. That's interesting that you're breathing too slowly. Yeah, not sure about that, but that's just my opinion. Waiting for appointment with breathing physio. Learning to breathe in through my nose before talking. I think that's talking. But it's really, really hard as it slows my talking down. So I'm continuing to try. Brilliant. That's Jennifer. This is one of the questions I had through. Somebody asked me the question. Well, they kind of put it into two sections. One was how do you, so I'm just trying to find my question. How do you breathe and talk and stand at the same time? I'm like, oh my goodness. Let's just think about the talking. So breathing in through your nose and breathing out as you speak, and then you breathe in again. So for a lot of people, that involves slowing down your breathing. Now, I call this advanced, but I think the breathing and talking is really hard to get that right. I know for myself, I will what's called breath stacking. So when I'm talking, I'll breathe in, hold my breath, breathe in, hold my breath, and then I'm holding my breath up here, and then eventually I go. So that's breath stacking. So it is really hard. You just have to keep practicing. I'd call that advanced. So just start off with basic learning to breathe through your nose. So the key thing is slow down your speaking, and that's a challenge. Yep. Learning to breathe through my nose after a lifetime of mouth breathing, learning diaphragmatic breathing and slowing my breathing, reduce loads of symptoms. Yeah, I'm not surprised. Yep. Yep, absolutely. So the key thing is nose, diaphragm, diaphragmatic, abdominal belly breathing, and slow. They're the key things. I find it hard to believe that any of you are breathing too slowly. If you think respiratory rate at rest should be between 10 and 12, and I say most people are not breathing that slowly at rest. With exertion, it will go up, but not massively. Yep. Still unable to hold my breath, brain kicks in and makes me take a breath. Yes, that's exactly what's going to happen. The breath holds, or all it's doing is measuring your sensitivity to carbon dioxide. So if you're more sensitive to carbon dioxide, your brain's going to kick in early. I wouldn't worry too much about breath hold times. Focus more on, it's a guide, but focus more on your symptoms and symptom improvement, and focusing on the nose, low, slow, rather than what your breath hold time is. Practice, absolutely. It takes a lot of practice. It's doing something every day round breathing, focusing on your breathing, and awareness is the key thing, is becoming more aware of what's happening with your breathing. So taping mouth at night, yeah. Buteyko breathing. So I'm not going to teach you any specific exercises today, but when I do my breathing workshops, I know Jennifer's been on my breathing workshops. I talk more specifically about some of the exercises that you can do. Mouth taping is an option. A lot of people find it really helpful, and you can just get a bit of micropore tape and put it across your lips like that. If you are going to do that, this is particularly if you are a mouth breather at night, but make sure you do it during the day, first of all, so you get comfortable with it. And yeah, don't feel it's something you need to do. But people who do it, they say that they sleep better and their clarity of mind is better during the day. They can concentrate better, which isn't surprising. Yep. I find I'm holding my breath. Yeah. Yep. Yeah, I'm not convinced that the respiratory physio I saw knew much about POTS, which could explain why they thought I was breathing too slowly. Quite possible. Tips breathing during a panic attack. Yes, you would have to come on my breathing workshop for that one. So, just going to questions now. Where shall we go from? I try to belly breathe, but even when concentrating hard, my chest still rises at least as far. How do I change it? Practice. Yeah, practice and slowing down your breathing. So Ben, you've written so much, I don't think I can read it all. I usually have some relief from this, but in the past 8 weeks, this has been constant, but no apparent medical explanation. Is this typical for POTS? So the air hunger thing and breathlessness is common with POTS, and it's a combination of your breathing is fast, your heart rate is fast, so your breathing speeds up. You can't control your heart rate, but you can influence your breathing. So focusing on all the breathing techniques can really help. It doesn't fix the heart rate, but it can just bring everything down. One of my clients, she did a bit of a experiment for herself. She put her, did some heart rate monitoring, and she consciously focused on her breathing and just breathing slowly. She's quite practiced at this now. And she noted, I think she said her heart rate went down from 130 to 110 just by focusing on the breathing. So that was just her own little experiment. But it's how you get there, how you slow down your breathing, and that's where a bit of help can make a big difference. Yep. Deep into the belly, probably slower. So if you're by using the nose and using your belly, that in itself will slow down your respiratory rate. So even just nose breathing will influence diaphragmatic breathing, and the combination will slow down. So if you take one thing away, is really work on slowing down and breathing through your nose, and that will help. Always been a nose breather. Post-COVID, I find myself mouth breathing at night, and sometimes I feel like I can't get enough air in through my nose. Is this a sign of a breathing disorder? Are you finding this shift in long COVID people? Yeah. So what I'm seeing, people with long COVID are sort of having stuffy noses. And I've had a number of people who, they didn't have a stuffy nose before COVID, but then as a result of COVID, they got a stuffy nose. Why that is, I don't know. So again, it's what's changed. Well, again, it's long COVID. We don't really know what's going on. One thing you can do, you can try the mouth taping at night. You can also buy some strips, so right breathe strips that just open out your airways, and it might just help you breathe a little bit better at night. How do you make sure we're achieving normal breathing? That's a very good question. It's a case of being aware and becoming aware. And if you can get input from somebody who can help you with that, that's always beneficial. But the tips that I've given you, hopefully it gives you something that you can go away and just become aware of yourself. Become aware of how fast you're breathing. Are you breath holding? Is your breathing erratic? As soon as you stand up, your heart rate goes up, you start breathing a lot faster. So just become aware of it and start to think about your breathing more. A lot of people say, I don't think about my breathing, I just breathe. So just try and become aware. So I'm just, Emily, you got quite a complicated question. Yeah, I think it's something to do, you're right. Hyperventilation, when you've done some activity linked with post-exertional malaise, there is going to be a buildup of lactic acid, and your heart rate might be faster, and your respiratory rate might increase as well. Yes, it wouldn't surprise me. But again, you can influence your heart rate. You can you can influence your respiratory rate. So spending time just trying to slow down your respiratory rate. Yeah. Yep. So somebody is saying that when they try to breathe and belly breathe, they find it difficult, find themselves feeling tense. Yeah. Yeah. So you need to go there gradually and try and relax your muscles. And as you go to the stress feeling is often because you're sensitive to the carbon dioxide. So it's just going there gradually. And again, if you came on one of my workshops, I can teach you some exercises that just start to make you feel a little bit more comfortable with the feeling of air hunger. So is there any difference between breathing issues in long COVID and POTS? People seem to refer to lung damage in relation to breathlessness in long COVID. Very good question. So long COVID and, oh, I've lost your question. Yeah. Long COVID, there's lots of different potential causes. So lung damage might be one cause of it. The people I've worked with long COVID, what I'm finding is that they all have a dysfunctional breathing pattern. And I've got one client who probably does have, or they've seen some scarring on her lung, but actually she had a dysfunctional breathing pattern before she got long COVID anyway. So most people, I would say, it's not due to any lung damage with long COVID. It's a very similar kind of pattern than what we see in POTS, and mainly due to breathing pattern disorders. Yep. But with long COVID, there is the is there something else going on? Is there some actual lung inflammation, which is going to influence? But the principles apply in terms of how to manage it. I have the air hunger when laid down sometimes, maybe. I have good slow belly breathing and low heart rate. Could it be anxiety? It could be. You're quite right. Oh dear. Any breathing apps you could recommend? Good question. So I currently use something called Heart Math. If you were at Dr. Lim's webinar last week, or whenever it was, he recommended Heart Math. So that's what I do for myself. My only concern with it is you need to be able to have a respiratory rate that you can get a respiratory rate quite low. And if you're not comfortable, so I think it's too hard unless you're already practiced at this. So the lowest is 4 in, 4 out. So I can't work out the maths. It might be 6 breaths a minute, but often that is too low, too fast. So I've worked with some people who are using or trying to use the Heart Math tool, but they try to do this, they try to get their respiratory rate that low, but then their breathing gets out of control, they end up gasping because it's just too hard too soon. That's what I am finding. I don't know of any other apps. I haven't found anything else that I think this is really good. Now, Buteyko International do an app, so it might be worth having a look at what they do, and that's got sort of breathe light exercises and some of the Buteyko exercises, and that's free, so you can have a look at that. Okay, I think that might be the end of that. So 1 or 2 other questions that have come my way. Somebody on Facebook asked a question, what's the difference between hypercapnia and hyperventilation? That's a very good question. So hypocapnia means the carbon dioxide in your blood is low, and that's going to lead to alkalosis. Hyperventilation, hyper meaning over, ventilation, so over breathing. So the hyperventilation is breathing too fast, more than the requirements of that your body needs. So hyperventilation will lead to hypercapnia. So that might answer that question. Yeah, I think I'm done. Does anybody, let me have a look. So somebody says here, I've had breathing pattern disorder with, and to my knowledge, I've never had anything like this before. Looking back over the last 15 months, I think my relapse has been triggered by stress. As I get back to full-time work during remission, I'm now aware of it. I'm trying to keep an eye on my stress and my breathing, and I'm hopeful that I can prevent further severe relapses. Brilliant. Yes, absolutely. Stress is a massive influencing factor, but we can't deny that. And the stresses could be over your lifetime. So a little stress here, a little stress there, and these stresses accumulate over time. Yeah. Could you add the website on here, please, for breathing exercise that you mentioned? What I'll do, I'll send Joe the Buteyko International app, and you can have a look. My one little concern about some of the breathing exercises, I've had lots of feedback of people saying that they'd really like some breathing exercises and videos of breathing exercises. I'm going to think about it and see what I can come up with. My concern is that a lot of the stuff that's out there is just too hard. I've had lots of people who've tried an app, and yeah, it's just too much too soon. So it's very difficult to kind of do a video or suggest exercises and say, do these, because to have a more tailored approach is the best option. So working with somebody and saying, okay, for you at this stage, just focus on this. rather than the sort of blanket, try this exercise. So like box breathing gets mentioned quite a lot, but then it can just be too soon. And if it's too hard too soon, then it further dysregulates your breathing, so it might not be helpful. That's my one concern, but I am going to see if I can think of something that might be useful for people. I find the soothing rhythm breathing exercise helpful. Okay, I think, Jo, we probably should stop there.
Yeah, that hour went very quickly.
I know, way quickly.
Thank you so much, Lorna. I mean, it's absolutely fascinating, and it sounds like it's very much, this is an introduction to it, and that there's so much to learn basically, and it's how to identify if you've got a breathing pattern disorder. Some absolutely great tips, and hopefully something that people will go and explore further and get some more information on. Is there anything else you want to cover, Lorna, before?
I don't think so.
No, so what I'll do is I'll send out information to you all who've attended, and I'll send you the links to everything that we've discussed, and the questionnaire that's on Lorna's website, so you can try and identify whether or not you've got a breathing pattern disorder. If you've got any questions afterwards, obviously just reply to that email and we'll do our best to come back to you. But yeah, I hope everybody's found it really useful. Please do take the time to fill in the feedback so that we can continue to develop our webinars for you. And thank you so much to Lorna again for giving up her time. You know, a lot of work goes into these presentations, and Lorna's constantly thinking of what she can do to try and add things to the website and what webinars we can offer. So thank you very much indeed, Lorna. It's really appreciated.
Thank you.
Thanks everyone for attending. Take care. Bye bye.